is being seen again in the world as soon as we thought it was over. The new strain of corona has once again created a stir. Brazil became the third country last month after the US to report a 24-hour tally of COVID-19 deaths that exceeded 4,000. India had a peak of almost 2,600,000 new cases in 24 hours and also set a new coronavirus infection record for the second straight week. The global death toll from COVID-19 passed 3 million, with the pandemic already having killed more people than most other viral epidemics of the 20th and 21st centuries. But there have been notable exceptions. The post-World War I Spanish flu wiped out 50 million people, according to some estimates. In 2009, the H1N1 virus or swine flu caused a global pandemic and left an official death toll of 500,000. That brings it close to seasonal flu, which accounts for between 290,000 and 650,000 deaths worldwide every year, according to the World Health Organization. In the 20th century, two major non-seasonal flu pandemics, Asian flu in 1957 to 1958 and Hong Kong flu in 1968 to 1970, each killed around 1 million people according to the counts carried out afterwards. In 4 decades, periodic Ebola outbreaks have killed some 15,000 people, all in Africa. Ebola has a far higher fatality rate than COVID-19. Around 50% of people who are infected die from it. But when it comes to corona, it not only put the lives in danger but also affected the world in other ways. The coronavirus has disproportionately affected the poor. For the first time in 20 years, global poverty is likely to increase significantly. The World Bank estimates that the coronavirus has pushed between 119 and 124 million people into extreme poverty. Today, nearly 900 million students, more than half the world's student population, continue to face heavy education disruptions, ranging from school closures in 29 countries to reduced or part-time classes in 68 others. In this video, we're going to take a look at this current pandemic situation and talk about from every aspect of it. But before proceeding further, we request you to subscribe to our channel to support us so we create more content for you. And don't forget to click the links below for amazing deals. Let's start the video. Guys, as the pandemic doesn't seem to leave us alone anytime soon, we all have one solution to stay away from this virus, which is vaccination. Every single country is being affected from corona, period. Talking about last year, situation was different. In countries like US, India, Brazil, and France, people were infected every single minute and every system was failed because of lack of resources. In countries like US alone, more than 100,000 cases were surging in a single day. Situation was so worse that there weren't enough accommodation to even admit patients. It was impossible to find a place to bury the bodies. US recorded more than 500,000 plus deaths last year. Talking about India, situation was almost the same. Government was not prepared. People were unaware of the severity of the virus. By the time they knew, the damage had already been done. Last year, India recorded maximum of 97,000 cases in a single day and more than 100,000 plus deaths. Then governments implemented lockdowns. Even though the situation was somewhat normalized, it was still not safe to roam outside freely. Since January 2020, vaccine development had been started in collaboration with pharmaceutical industries and governments. Prior to COVID-19, and no vaccine existed for preventing a coronavirus infection in humans. So, it was already been notified to the world that first vaccine may take a year to finish testing and releasing it for public use. On June 24, 2020, China approved the CanSino vaccine for limited use in the military and 2 inactivated virus vaccines for emergency use in high-risk occupations. On August 11, 2020, Russia announced the approval of its Sputnik 5 vaccine for emergency use. Though 1 month later, only small amounts of the vaccine had been distributed for use outside use. Scientists around the world were working faster than ever to develop and produce vaccines that could stop the spread of COVID-19. In December 2020, there were over 200 vaccines for COVID-19 being developed. But by the end of 2020, only few were able to get authorization from WHO to start their trial on humans. Let's talk about such 6 vaccines available all around the world and their effectiveness. But before that, we will answer one of the most doubtable questions. Do vaccines cure COVID-19? The simplest answer is no. The objective of vaccines is to reduce the severity of the virus and minimize the impact as low as possible. But it doesn't kill the virus. So if you're already vaccinated and think you will never catch the virus, think again, because you're wrong, my friend. Now coming to vaccines, 6 different COVID-19 vaccines are currently being used around the world, and just over 300 million people have received their first dose. Covaxin, also called as BBV152, the vaccine is developed by Indian pharma major Bharat Biotech, and the Indian Council of Medical Research approved its usage. Currently, India is the only country that using this vaccine. Covaxin is a safe vaccine with mostly mild to moderate side effects. Its first interim data indicates efficiency of 81% at a 4-week interval between 2 doses. Covaxin requires 2 fully doses with a gap of 28 days. The vaccine is currently sold at $2 per dose to the government. The price on the private market is not known. Sputnik 5, developed last year by Russia's Gamaleya Research Institute of Epidemiology and Microbiology, the vaccine currently is being used in 9 nations. Sputnik 5 updates from Russia and other countries suggest that the vaccine is safe with mostly mild to moderate side effects. Its data indicates 91.6% efficiency. Sputnik 5 requires 2 full doses with a gap of 21 days. The indicated price of a single dose is $10 per dose. Moderna, also called as mRNA-1273, the vaccine is developed by United States government and pharma major Moderna. The US vaccine is currently used by 27 countries. It is a safe vaccine with mostly mild to moderate side effects. Moderna vaccine has an efficiency of 94% after the second dose. It also requires 2 doses after a gap of 28 days. The vaccine is priced at $15 per dose in the US. Oxford AstraZeneca. Developed by Oxford University and AstraZeneca, it is being used in 41 nations including India. AstraZeneca joined hands with Serum Institute of India to manufacture and ship the vaccine across the globe. It has an efficiency of 75% and it costs around $10 per dose. The good thing about this vaccine is that they are much easier and cheaper to produce and transport, as they can survive in standard refrigerators for up to 6 months. Johnson & Johnson. J&J vaccine is based on the adenovirus vector platform. J&J is a safe vaccine with mostly mild to moderate side effects. J&J vaccine was shown to be 66% protective against moderate to severe COVID infections overall from 28 days after injection. J&J COVID-19 vaccine requires single dose and storage temperature of 2 to 8 degrees centigrade. J&J vaccine is priced at $10 per dose. Pfizer-BioNTech vaccine, also known as Comirnaty. The vaccine is developed by BioNTech in cooperation with Pfizer. This was the first vaccine to have received authorization for emergency and regular use. It is currently being used in 61 countries. Vaccine is based on a technology that had been studied for 20 years for its use in treatment for various types of cancer. It has an estimated efficiency of 95%. The doses are same as other vaccines, which is 2. It has been proven very high efficiency to prevent symptomatic infections. There was a need for all this if this pandemic hadn't happened. To know where it all started, we have to go back in time and see it for ourselves. A year ago, on December 31, 2019, WHO said that there was a mysterious pneumonia and is sickening dozens in China. Many of those sickened had visited a live animal market in Wuhan. Just after 20 days, China reported first death from novel coronavirus. A 61-year-old man who visited the live animal market in Wuhan died. The disease appears to have originated from a Wuhan seafood market where wild animals, including marmots, birds, rabbits, bats, and snakes, are traded illegally. The first corona case outside from China came from 10 days when a man in his 30s from Washington state who traveled to Wuhan got diagnosed with novel coronavirus. Japan, South Korea, and Thailand also reported their first cases one day prior. On January 23, 2020, the world saw its first coronavirus lockdown come into force in Wuhan, the Chinese city where the pandemic is believed to have started. At that time, the wider world was shocked by the harsh restriction and rigid enforcement. From late January until June, the city was effectively sealed off from the rest of the country. After that, in countries like India, US implemented lockdowns. Flights all around the world were halted for a few months. People arriving in countries had to go through 14-day quarantine with rapid corona tests. In 2019, more than 4.5 billion passengers took 38 million flights worldwide, with lockdowns and quarantines for most of 2020. Many canceled or postponed travel plans. International passenger demand in 2020 dropped by 75.6% compared to 2019, according to the International Air Transport Association. It was all chaos as world had never seen such deadly virus after Ebola. The hunt for the animal source of COVID-19 is still unknown, although there were some strong contenders. A team of virologists at the Wuhan Institute for Virology released a detailed paper showing that the new coronavirus's genetic makeup is 96% identical to that of coronavirus found in bats, while some said in pangolins. Coronavirus has affected financial pillars of all countries. Recessions have started in several countries. When we thought it was over, it came back again. Vaccination and cooperation is the key to save our lives. That's it for today. Stay safe, wear your mask, stay at home. We have to defeat this virus together this time. Goodbye.